I'm Monica Rohr, a member of the Houston Chronicle's Editorial Board. This week, we urged Houstonians to stay home to slow the spread of the coronavirus. Stay home. That's it. That's the tweet. That's the Instagram, the TikTok, the meme. Whatever source you rely on, that's the message. Stay home to stop the spread of COVID-19. Stay home to save the lives of your grandparents, your parents, your favorite aunt, your best friend recovering from cancer, your neighbor with diabetes. Stay home to save your own life. Even if older people are at higher risk of death, that doesn't mean middle-aged and younger people aren't getting sick. They are. Stop going to restaurants and bars, those that are still open. Don't arrange play dates for kids unexpectedly on coronavirus break. Don't invite a few friends over for an impromptu cookout or brunch. Don't go swimming and sunbathing on a crowded beach. We can't act like the world is proceeding as normal, because it isn't. As of Wednesday afternoon, the novel coronavirus had sickened 201,000 people and killed at least 8,272 in 44 countries. In the U.S., there have been 7,324 cases and 114 deaths, with the numbers expected to grow exponentially as more people are tested and as the virus spreads. In the space of a few months, since the first case was reported in China, life as we knew it has vanished. Major league sports are on hiatus, schools are closed indefinitely, Disney World and Disneyland are shuttered. President Trump declared a national state of emergency. The San Francisco area is under mandatory shelter in place, an extreme measure also being considered by New York City. The longer this emergency lasts, the more likely that strict rules will be adopted in Houston. We can't assume they won't, and besides, it's much safer to assume they will be. Already, Houston and Harris County, which are under extended disaster declarations, have ordered bars and restaurants closed except for takeout and delivery. The million little things we took for granted, recreational soccer games and gym workouts, Sunday morning church services, and big birthday bashes. It is hard to grasp the enormity of this moment and the scope of the challenge we are facing. It is tempting to cling to shreds of normalcy when everything around us has suddenly been flipped inside out. But that's a dangerous, even deadly delusion. Of course, it is frightening to accept the scenarios described by public health officials and infectious disease experts. A dire analysis by the COVID-19 response team at Imperial College London predicted that unless governments and individuals try to slow the spread of the virus through drastic restrictions on work, school, and social gatherings, 2.2 million people in the U.S. could die. We've never seen anything like that in this country, where an estimated 500,000 people died in little over a year from the Spanish flu, beginning in 1918. The statistics should alarm us, but not paralyze us. We are not powerless. It is critical for governments to act quickly to increase testing, make sure the medical system is equipped with ventilators, protective gear, and hospital beds, and order limits on mass gatherings. The rest of us are going to have to prepare for a world we've never been used to. Food shortages at times, supply chain disruptions, potentially widespread layoffs. We may see medical care delayed or rationed. To get through it, we'll need all of our kindness, courage, discipline, and perseverance. But Houston, we have that to spare. There is something even more immediate we can do to slow the spread of the virus so that the medical system doesn't collapse under a surge of cases, which would result in more deaths. Stay home. There are, of course, exceptions. Trips to the grocery store, doctor's visits, runs to the pharmacy to get prescription medication. Some people must go to work. Doctors, nurses, grocery store workers, delivery people, first responders are on the front lines of this battle, risking their own health to treat, feed, and protect the rest of us. Many low-wage workers, including home health aides, don't have the option of telecommuting. But we all must do our best to follow the guidelines put out Monday by the Centers for Disease Control and Prevention, which advised everyone to work and school from home whenever possible. Stay away from groups of 10 or more people and avoid eating in bars, restaurants, and food courts. We are asking every single American, no matter what your generation, from Z and up to X and millennials in between to really ensure that you are following these guidelines, Dr. Deborah Birx, the White House Coronavirus Response Coordinator, said at a briefing. We hear every night of people who are not in work moving that time into bars and other areas of large gatherings. If we continue with that process, we will fail in containing this virus. Younger generations, Birx added, must stop going out to bars and restaurants and spreading asymptomatic virus onto countertops and knobs in grocery stores and grocery carts. That is also the message of the Stay Home campaign, led by a nonpartisan coalition of healthcare professionals, including former U.S. Surgeon General Vivek Murthy and Andy Slavitt, former acting administrator of Centers for Medicare and Medicaid Service. Their message to the public, Slavitt told the editorial board, people's lives are in your hands. Anyone of any age, whether or not they are showing symptoms, can pass the infection on to folks in high-risk categories. On average, an infected person spreads the virus to 2.5 other people, who can then spread it to 2.5 more, and so on. Social distancing, staying away from people outside your immediate household, is the most important thing that can be done. Not only could it save the life of someone's grandmother, it could prevent a previously healthy young person from having lifelong medical problems. Much is still unknown about the long-term impact of the virus. Some reports say it can cause scarring of the lungs. In France, more than 50% of coronavirus patients in intensive care are under 60. We are in for a long haul. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said Tuesday it could be weeks before we know whether social distancing measures are helping. The Imperial College researchers warned that it may take as long as 18 months. That is a daunting prospect. But, as a popular meme making the rounds says, previous generations were called to war. We are just being called to sit on the couch. In the Houston area, we are no strangers to hardship and disaster. We understand that we are all connected, and in times of need have responded in kind. In floods and hurricanes, we came together to help our neighbors. Now we are being asked to stay apart to do the same. We can do this. Recording from my home, this is Monica Rohr on behalf of the Houston Chronicle Editorial Board.